Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you another in our series of interviews with top leaders in health IT. And we're here with Dr. Robert Lackey. He's Chief Medical Information Officer at WellSpan Health. Welcome, Rob.
Thank you. It's nice to be here.
Yeah, so we're here at the HIMSS 2022 conference, and you're sharing a project you did to really consolidate the medication history after a number of acquisitions that left you with 3 EHRs. Common problem by a lot of organizations. Tell us about the problems you faced.
So as we were combining our 3 separate EHRs into a brand new one, how to get that information efficiently and accurately into our new EHR is a process that a lot of organizations struggle with. Some organizations will just wholesale say we're just going to start over. They won't import problems, meds, allergies, and immunizations, and we abbreviate that PAMI. Problems, allergies, meds, ends. And some organizations will, like we did, we spent a lot of time and effort trying to get that information into the new EHR, but it's a very expensive proposition to get that in, all that information in a usable way, so that on day one, all of the physicians and care team members are ready to go. And it's a huge hurdle that a lot of organizations struggle with.
Yeah, absolutely. And you want to make sure it's trusted. You want to make sure that it's done right. And so it is a really challenging problem. So what options did you consider to really address that problem, and what did you finally choose to do?
Well, thankfully, we had some experience. We had done this a couple of times before. And our experience told us that we can pay humans to look at the old EHR and manually transcribe that information into the new one.
Which has some challenges too.
It does,
errors
right? And getting the manpower to do that is a challenge. We actually had to hire consultants to do that, which are expensive. And we had different ways of extracting information using CCD extracts out to present it in the new EHR. But even that had some challenges. The nomenclature of the source EHR isn't the same as the nomenclature of the destination EHR. And so that also was taking humans to do that translation. So we were looking for a better way to do that.
Okay. So how did that, I know you used the Doctor First AI solution to help improve the quality. How did that help, and what was the process there?
Yeah, so there are actually a couple components. One isn't so hard, but it does take work to do it, and that's programming an interface to say, well, if source EHR1 uses the words by mouth, and the destination says, use the words oral, create a translation table. Whenever you see by mouth, change it to oral. That's the easy part. The hard part, though, is when, say, the source EHR doesn't have all the details of the SIG. My favorite example is atorvastatin. Cholesterol-lowering medicine. It's only ever given by mouth. It's only ever given once a day. But sometimes the source EHR will just have atorvastatin 10 milligrams, that's it. None of the rest of the SIG. Wow. The beauty of the smart processor by Dr. First is that it has artificial intelligence that infers what that SIG is going to be. So as it gets presented to the user to say, does this SIG look good? It already says 1 tablet by mouth once a day, easy peasy, as opposed to getting a whole bunch of yellow triangles. Please select the route. Please select the number of pills per day. Please select this and that. So we were able to eliminate all those hard stops or yellow triangle stops and get much more accurate information into our new EHR. So again, on day one, the med lists were looking great. It really worked fabulously.
Well, it's interesting, with 3 EHR conversions, you probably needed some technology to help you, right? I mean, otherwise the project goes on too long, you can't hire enough people. Is that what you found?
Yeah, in our previous experience, the number of man hours it took to do all those conversions, satisfying all the yellow triangles, it took a long time. With the smart data processor through Dr. First, it really made it easy. It was looks good, click, except we were able to cut down the average time it took to do a PAMI conversion, and I got to think back now, 10 to 12 minutes per chart down to 6 to 7 minutes per chart.
Wow, that's
so
quite a change.
A lot of time savings there. We had budgeted, I don't think this is proprietary information, but we budgeted $1.2 million to do all the manual conversion, and we ended up only spending $480,000, so about a 60% savings. Now, in fairness, I can't say it's all due to Dr. First because there were lots of challenges going on. This is occurring right when the pandemic was hitting, and so we had to pivot on how are we going to do this work, whereas before we had all the workers coming into a central location, plus our hired consultants working remotely. Now we said, you know what, we can't gather. We're going to have everybody work remotely. That freed up our workforce all to work from home, and altogether, again, a lot of cost savings there for a multitude of reasons. But 60% savings in our budgeted costs, we are really pleased with how that all went.
Yeah, the CFO loves that. It doesn't happen with IT projects that often, so that's great. What was the experience of the end users after it? I mean, everyone hates switching EHRs and converting EHRs, but talk about the experience that now the data was there and available.
Yeah, so we had done a pretty good job spending a lot of money doing a lot of manual process before. So we already had high expectations for what our user experience was going to be. So coming from other EHRs, on day one, our users were up and running with pretty good med lists. This process maintained that same high quality. But the additional benefit was that whereas before we had to keep running our PAMI workers months and months after go live, we were able to finish up doing our PAMI conversion in this latest conversion quicker. So we didn't have workers all over the place. We didn't have docs calling up and saying, hey, this is an add-on to my schedule and the chart hasn't been PAMI'd. We already had them all done ahead of time. So it was a really good experience for our users.
That's great. Well, Rob, I appreciate you taking time to sit down with us and share your experience with this great project. And thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com and also search for healthcareittoday.com on your favorite podcasting application. Thanks, Rob.